Um, so let's start with the question that you were saying, and then we have kind of a list of questions that we're asking different
Sure.
experts today. So we'll go through those. But the first one I think is important to highlight. It's a big deal. It's becoming a bigger deal, but it's important to stay calm, right, and put it all into perspective.
Absolutely. So the way I think of this is thinking about, well, what if the weather person said that we have a big storm coming and it could dump anywhere from 2 inches of snow or 2 feet of snow? Obviously, we won't know till the storm actually gets here and actually has that effect. But you would plan for that. You would think, okay, I need to have gas in the car. I might need to have water and food at home because I might not be able to go to the grocery store. And then, of course, if schools are closed because there's too much snow, you would plan for that as well.
So I guess what's important to highlight right now is that you need to put it into perspective, plan ahead, but don't freak out, right?
Exactly. You want to plan ahead so that you're not stuck thinking, oh God, now we don't have medications, or we don't have what we need, or we don't have a backup plan for childcare. So that's really the bottom line for that.
I usually don't do this, but I'm going to look at my phone just because we're asking the same questions to a bunch of different people. We've been planning theoretically for something like this for years, I imagine, for decades. What are some of the big lessons that we've learned in that preparation that now could become useful?
Sure. So I think with H1N1, which was the last pandemic that we had, although this technically has not been called a pandemic, it's behaving in that capacity, is really communications and making sure that everybody has information that's accurate and timely, because I think there's a lot of anxiety over what's next, what's going on, do I know what's the latest and greatest? And so just having good communication plans on all levels, with the public, with the hospital, with the staff, everybody that needs to know will know that, yes, on Thursday we will let you know at 8 a.m. if there's anything new. If it's an urgent thing, you'll get a text or whatever. And so I think that's really important.
What are some of the biggest pandemics that we've seen in recent years or recent decades that have maybe prepared us for this?
Certainly 2009 H1N1 influenza was one of the biggest that we've seen, where it kind of started in a similar fashion. There was, a couple of cases here and there, and then it just kept escalating in terms of the number of cases we were seeing. It was initially tied to travel to Mexico, and then of course it expanded into a worldwide phenomena. So I'd say in recent memory, most people will remember that. SARS and MERS are probably the other two that weren't pandemics, but certainly emerging infections that made us worry this way too.
If it got to a quarantine in the United States, kind of like we've seen in China, what would a quarantine look like in Denver?
It's a great question. And so most of it would probably involve limiting big public gatherings. So if a Fish concert was happening, perhaps that would be asked to be canceled. So a lot of it is what we call social distancing, where you just don't have hundreds of people or thousands of people en masse in close proximity to each other.
This is an election year where we have campaign rallies every other day. Is that kind of something that people are maybe looking at as like, this might have to change how we do that?
I would imagine it's going to potentially impact that. Obviously, it's all predicated on how quickly it comes, if it comes, how quickly it spreads. And I think there's still a lot of information we're waiting to hear back on as far as how sick are you going to get and how infective is it really? And is this close enough, or do I need to be really close to you? And so those could potentially still happen, but maybe they need to happen in a different arrangement.
We've seen flights to China be disrupted or stopped by some airlines. If it were to get as bad as it is here, could we see that happen here? I mean, is that part of something that could happen?
So I think that was a very interesting approach. Certainly, I think it was warranted to try and keep this from spreading. But historically, if you look at these kind of measures of banning travel or trying to keep people's borders closed off, it's historically not been very successful.
Interesting. Are things like food shortages or medicine shortages, are those realistic here?
I think it's hard to say. I would say probably not, only in the fact that we're even talking about it. It means that somebody's probably thinking through, like, okay, what do I need? Do we have enough production? What is our plan B if factory X? I think this is part of usual operations where there's natural disasters that occur frequently enough that most, I think, companies and other operations think about these things more so. And so I think, again, putting it into that kind of context of disaster, it's not a disaster at this point, but the planning that goes into it would be, again, very similar.
In a sense, it's good that people are talking about it.
I think it is good, but again, I think the talk that I've been hearing is at a level of probably excitement that it doesn't need to be yet.
Got it. How many cases would we need in the United States for it to become a big deal? I mean, it's not there now.
No, not even close. So that's a great question, and I don't actually know that I know the answer to that. I think it depends on your perception of things, right? So if you're the person whose school got closed for the week because there is a case in that area, that's a big deal to you. But as a public health person, it's only one case or two cases, maybe not such a big deal. So I think a lot of it depends on where you sit on that spectrum of what is a big deal to the individual versus the global. There may be two very different answers.
You're an expert in this, in trying to control these types of things and how they spread and things like that. We brought up schools. Is that kind of something that you say, kids go to school and touch everything? If one's infected, it can easily spread it. And we hear about that with the flu all the time.
Sure.
Is shutting down schools a realistic thing that if it spreads to the point where people are fearing it could be, that could happen?
I think it would be a consideration. It again depends on how well you can get control, how extensive it is, how sick people are. So I think it's like we do in flu season or when there's norovirus outbreaks, and sometimes there needs to be mass cleaning of the schools. So I really think it kind of depends. I'm not sure that there's really a one approach that's going to fit every situation.
Just a couple more here. Beyond hand washing and stocking up on Lysol, I guess, what are other things that people can do to prepare and to keep themselves healthy, I guess, if it starts spreading?
Sure. So basic things that we would tell you to be healthy anyway, right? Stay hydrated. I can't overemphasize cleaning hands with either alcohol sanitizers or soap and water, cleaning surfaces like your cell phone or other things as well, awareness of touching your face or where you're touching your nose. And then the other things that make sure you have what you need in the household. So make sure that you have good food and adequate medications if you need them.
There's a lot of people who have asked us something interesting that I don't know the answer to, so I wanted to ask you. Is it safe to order something, say, from Amazon that comes from China?
Sure.
Is it possible for that to be infected?
No. Viruses really need a human or a host of some kind to survive. They can certainly survive outside of the body for periods of time, but it's usually only under optimized conditions, like in a lab where they're doing experiments kind of thing. So they can survive outside the body for a little while, 30 minutes, maybe a couple hours, but certainly not on the train or the airline or however long it takes for them to get from the station where they're being sent in China to the United States. So it is a zero concern. If you're really feeling paranoid, sure, open it up and then wash your hands. And it's probably not a bad thing because there's probably dirt on the box.
But that's not something that it can spread through packages.
No, not at all.
It's been talked about that Fort Carson could potentially house quarantine people for the federal government. If people are indeed housed at Fort Carson, should people that aren't infected, people in Colorado, should they be freaking out that there are people who are infected nearby?
No, I mean, how many people do they know have the cold right now? Probably at least one person that's sick. And so again, you want to proceed with some level of concern or caution, but again, it doesn't warrant the excitement that I think that some people are feeling. And I think a lot of the uneasiness is because it's new and there's again not enough information that people feel like is being given to them to satisfy what they need. But I think consider this, like I said, snowstorm. 2 inches, maybe 2 feet. In both instances, you would potentially alter what you would normally do. And in both instances, we could be completely wrong. And it could bypass it and go a different direction.
Let's hope it's down. Anything else that I've missed that you want to add?
I don't think so.
Let me ask you one last question.
Sure.
If you could put it into perspective for us, with maybe comparing it to the flu or to SARS or to H1N1, how big of a deal is this?
Again, I think it is a big deal in that it is obviously having some level of mortality, and I think again there's some unknowns that we haven't fully explored. But H1N1 still is severe for a lot of people, but wasn't quite as severe as was anticipated. And so I think we hope that will be the case with this, where it may spread, it may affect a lot of people, but maybe won't be as deadly as we think it could potentially be. or we could have the worst case scenario where people do get very sick and end up needing medical care. So I think it will evolve as it will. Predictions often are off the mark. So I hope it is sort of like H1N1 in the sense that a lot of people didn't get so sick from it.
Time will tell.
Time will tell.